I just like the process of basically creating an art, shaping the tooth, and then at the same time making sure that patient safety is the #1 thing. You don't want to hit the adjacent tooth or damage the gums or damage the tongue or any other vital structures around it. That's my fun thing around it, is just being able to create an art form.
Every doctor does things a little bit differently, but for the most part, it's all the same. I think we're good. I'm gonna grab a couple more things. It's a regular crown prep procedure, so we have our basic stuff usually that we need.
I'm just looking through her notes, verifying everything, and then verifying the length of her roots to make sure I have the correct measurements.
So Dr. Yi, once we get in there, we start prepping. We'll use the post system that we have. It's a fiber post. It'll get placed in there, bonded fully permanently, give her more hold when we're prepping for her crown.
And then look through her 3D image that we took before and kind of confirm the length from there as well. All right. We'll just review what we're gonna do today. So we're gonna remove material in the gutter pressure that I placed, and then we're gonna place the post so that it retains the crown portion, and then we're gonna prep the crown, get you a new one in about 2 weeks, okay? On that upper left.
Okay.
Sounds good? Okay, we'll get you numb here. I mean, each tooth is unique. Further back you go, there's less space, so it gets harder for the prep and for the instruments or whatever material that needs to go back there. Go ahead and open.
Keep breathing, honey.
All right, go ahead and open. I just like the process of making sure that each step is taken care of accordingly. All right, we're gonna get a scan going and then let that anesthetic do its magic, okay? So after decision was made with the treatment, we took additional x-rays called CBCT. It's a 3D x-ray, and that kind of gives me a image of what the tooth looks like in the 3D version, how many canals are in there, how deep the decay is. It gives me a better picture of what I'm going to be tackling.
All right, awesome. So right now what I'm doing is I'm actually scanning. It's a pre-scan, and it's something that I do for all the doctors when we're doing crown preps. And this allows me to have the scan ready during the time that she's just getting numb. At the end, I go back in with my scanner and I just cut out around the tooth that we're prepping. So it makes everybody's life easier, smoother, more streamlined. Looking good, so we're all done with that for now.
And then I do need that rubber donut that's on the endo files. I need one of those too. You know what?
Yep, the stoppers.
The stoppers, yeah.
You know what, hold on. Let me look at the posts, because she just got some new posts.
There's some posts
they
with
might,
it, right?
Yeah, that's what I was gonna check, these new posts.
Okay. The tooth, of course, had 2 canals, and then the decay was very deep. So of course, that's when we suggested a post. So I'm just picking out a burr, make sure the hand pieces are working, and then we're gonna place the rubber dam here to isolate the tooth.
Remember, this is just to help you stay relaxed and open throughout the appointment.
Just gonna hug your tooth here that we're working on.
There you go. A lot of pressure here, okay? The goal is to always work with the wider canal for post placement.
And I'm gonna use this, what we call Gates glidden, clean it out.
And what this Gates glidden gonna do is it's actually gonna go into the canal, remove just a little bit of that gutta percha material to make room for the post. You good? Right now he's just deciding what post size he's going to want to use and if it's at the right length.
I'm going to go at about 15 millimeters for the post.
I'm gonna start setting up for an x-ray to ensure we're exactly where we need to be. We've got an amazing system here at Oasis, digital x-rays with great resolution. Allows us to really see everything we need to. All right, grab our lovely endo wren. All right, honey, I'm gonna set you up just a bit more, okay? What's nice about this wren here, it allows us to leave everything that's in the tooth in place without disrupting it and still get an image. Stay just like that. I'm gonna take this dam off, okay? And I'll give you some more suction here. Okay, let's make sure. All right, and we got what we need. All right, we'll let Dr. Yi know that that's up. Make sure he's happy with where that placement of the post is at. Ah, you're coming, great. We're moving along, we're moving along.
We want at least at the end of the root tip, about 5 millimeters of this material called gutta percha. And then we want about 2/3 of the root to be filled at least. So the whole purpose of the post is to retain the core material, that's where the crown is, and then that'll retain the core for a crown to ensure that the crown fits as well. So
Want to rinse again?
get in there.
We
Just need like 2 more millimeters down and then we should be good.
Okay, so this is where we have all of our lovely endo rinses solutions. And we're just gonna rinse the canal now that he's gone in there to make sure it's clear of all debris. Just with a little bit of chlorhexidine. All right, let's rinse it. All right, so now we're cleaning up the tooth. We're gonna be etching, bonding to place the post with its permanent buildup material that we have.
Bonding.
Did you want some paper cones or are you okay with just that air?
Yeah, that should be good. Okay, go ahead. I like your very close here, okay. Still a little bit of okay on the distal. So I'll remove that and then we'll do a buildup.
Maybe a Tafelmeyer.
Yeah,
for sure.
Try Tafelmeyer.
Yeah, I think that might be the trick.
And then after placing the post, we place a buildup around it.
Okay, so in this case right now, the cavity was really deep on the back side, the distal side of the tooth. So we need to place a buildup, which is just, you know, building up the tooth with the material that we have here. And we need to isolate it. So we were just looking at it and have decided to use a Tafelmeyer band, which just hugs the tooth and it allows us to kind of isolate so the tissue's not bleeding in there. No bacteria gets in there while we seal that portion.
So I'm going to perform what's called crown prep to reduce the size of the tooth so the final crown can fit over it. I usually start with the interproximals.
And the IsoShield that we use is so amazing. It keeps the patient propped open while suctioning at the same time.
We're going to pack forward and scan. Make sure we see all the margins. And then we'll get your temporary going. Right now we're going to pack core so we can move the gums away from the margin so we can see the margin all around. And then we'll take a scan. And then once I confirm that I can see the margins all around and we have enough clearance on everything so that the vinyl crown material fits, then we send it to the lab.
Okay, bite down. Let me know, do you feel like you're hitting on that pretty good? Like not hard at all? Blends in? Perfect, I'm gonna polish it.
We prep the crown and then we deliver the crown for basically a new tooth for the patient.
A little pressure here, honey, okay? You're doing so good. Let me let Dr. Yi know we are done. You did great.
Yeah, you did awesome.
Let's take you up front. Okay, if you want to come on over here with Miss Brisa.
In about 2 weeks, she'll come back and then we'll have the final crown ready for cement.